started, and I'll just move the slide along here. Just 1 second. Well, so welcome to our webinar, Coaching in Healthcare, Nuts and Bolts. So we hope that you're going to leave with some very, very useful information. And I'm just going to move the slide along. And first of all, what I want to do is I just want to briefly share who we are, who is delivering this webinar. And so I will introduce, well, first of all, we are all, the panelists that we have today, we are all passionate that everyone in healthcare learns coaching skills. And that goes without saying, but I just wanted to share that. I'm Allison Henry, and I'm the CEO and the founder of Coaching Out of the Box. And as you can read the slide, you can see all the various things that I have, all the various important things that I have to say about myself. But I just want to just briefly mention that when I first got into coaching, I never intended or didn't really have a whole focus on coaching in healthcare, and that it evolved over time. But it has been just such a fabulous experience as to what's going on in healthcare with supporting people in learning coaching skills in healthcare, that we really want to make sure we share the story as much as possible. So that is a little bit about me. And then I'm very fortunate to have 3 guest panelists today on our call who are all within the healthcare arena. And Artie Koppas she is a healthcare leadership coach and facilitator, and she also is a licensed trainer of Coaching Out of the Box. So she has worked with me, with our organization, in delivering coaching skills training to healthcare, people in healthcare. And she'll be saying a little bit more during the presentation. And Dori Van Stoke is also another healthcare leader. She comes from extensive experience in healthcare long-term, and also was very pivotal in actually Coaching Out of the Box happening in healthcare. And that's, I really appreciate that, and has been just a fantastic advocate for it, has extensive experience in it, and all kind of some of the nuts and bolts. And you'll hear a little bit more from Dori as the webinar unfolds. And then last but not least is Ace, who it happens to be your birthday today. So happy birthday, Ace. And Ace is a researcher with a scientific focus area, and in particular in diabetes. And I was fortunate to meet her last fall at Harvard when we were presenting our findings, which we'll speak a little bit more to as the webinar unfolds. But Ace is going to speak a little bit about some of the work that she's done with diabetes and coaching, and of which she presented her findings in Vancouver last December, I think, if my memory serves me correct. So that's just a little bit about who we are. What I also want to mention is our objectives for this webinar. And by the way, it is being recorded, and it will be sent out afterwards. The recording will be sent out afterwards to all of you, so that if you want to review it, etc., etc. And what we're going to share about today is the current challenges, or at least the ones that we have seen. I'm going to ask a couple of questions about your thoughts about that, and we're going to speak to the hunger for different kinds of conversations within healthcare, people's desire for that. We're going to talk a bit more about, because we've learned that sometimes there's a bit of confusion around this, but what is being coach like? What is the coach approach, and what are some of the myths? And also, well, what about this whole business of being a credentialed coach or a certified coach, and is that required, etc.? We're going to share some of the results that we've seen achieved in healthcare when they have adopted a wide-scale coaching skill development for their people, and some of the trickle-down impacts. And we're going to share with you a few examples of how it was rolled out in a few different large healthcare organizations, and also some of the learnings. And what is not on that little slide is that we're also going to open it up for Q&A. So there will be opportunity for Q&A as well. You can submit questions in the Q&A box, assuming that you can see it on the screen. I have opened it up, so hopefully you can see it. Or if there's some reason that you can't, please feel free to use the Zoom webinar chat area, and we'll kind of take it from there. And if not, we might be able to get you to raise your hand, and we could hear you speak the question. All right, so that's what we're wanting to do first. Oh, whoops, I spoke too quickly. I have a poll that I want to ask, and I'm going to launch it. It's the first time I've been using a poll. And so it does see both questions at once. All right, well, that was a new learning for me. So hang on, because there's two questions, but before you answer the questions, well, some are already, which is great. I'm going to also put up what we have seen are the current challenges and pains for those working in healthcare today. So I'm going to give a little bit of time for you to answer the questions, and I'm just going to, it's pretty obvious on the screen, and I'm thinking many of you may have experienced this: lack of communication, lack of appreciation, lack of opportunities for development, just lack of clarity about job descriptions and what are the responsibilities, stress, overwork, not so great team dynamics, conflict, how to resolve conflict, and not that many or shortage of conversations that are solutions focused and promote accountability. So I'm just going to hang on because I'm still waiting for a few more people to vote, and then I'm going to share the results, and we'll speak a little bit more about that. So just bear with me. I'm just hanging on a little bit longer so we get everybody able to answer the questions as best they can. We'll give it a little bit more time. Okay. Well, I'm going to publish. I'm going to end the poll, and let's see what we've come up with. And I'm going to share the results with all of us. All right. So interesting. We have 74% that are from healthcare, and we have 26% who are not. And by the way, because what we've learned in healthcare, and Coaching Out of the Box works with many different verticals, many different organizations, not all healthcare related. And what we have found is that if it can work in healthcare, and I remember different times when we've been delivering the trainings and so on, people said to us, well, remember, in healthcare, there are multiple stakeholder groups. There's so many different types of people that are working in healthcare. It's just not one particular sector. So good news, what you learned today, or what we hope you leave with today, is recognizing how you can do it in any kind of an organization, or certainly a number of components of that. And the other thing is, oh, that's interesting. So the challenges that we put up, you agree with those. Okay, good. I'm glad. It sounds like we got that. We got that right, which is great. So moving right along, I'm just going to flip my pages over. I'm hoping, Dory, that I'm going to move to the next slide, and that is around this hungering for different kinds of conversations, because I remember speaking with you and hearing that you talked about that, and I'd love you to take yourself off mute and you go up to that microphone. Good, great. Hi, Dory.
Good morning.
Thank you so much for coming.
You're very
And
welcome.
And so can you share a little bit more about what you mean by that, this different kinds of conversations and what it is that you've seen?
Well, there's lots that I've sort of seen and experienced in healthcare over the many years I've been in healthcare. And, we go into this profession with thinking that we're going to help people, and we go into it with empathy and compassion and wanting to sort of be there and be connected. And what ends up happening is, I think, with the stress and the busyness and the everything that sort of gets piled on, those things kind of tend to get a bit by the wayside. And I think what people really want to get back to is how do we actually really connect with each other, and not have to be so professional or be whatever it is that we're supposed to be or behave like. How do we get back to actually connecting on an emotional level, on a personal level, but not bearing your soul, but being able to sort of really have the opportunity to get to know people, not just your colleagues, but also patients and families, where it's a relational industry. We work in an industry that's about relationships. And so how do people want to be able to actually connect on a deeper level, but not get enmeshed where they're, crossing the boundaries, so to speak, as we would sort of say in healthcare. So there is a yearning for connecting and being compassionate and being there, being present to each other, and to our patients.
So this is very interesting. So what I'm hearing you say is that you're supposed to be like that with the patients and the families and so on and so forth. But what if I'm understanding you correctly, it wasn't happening that much, or you weren't seeing it as much amongst the people you work with, meaning the senior people, or could you say, sorry, go ahead.
I won't go with the senior people, but for sure. I think for sure when you get into the day-to-day and tasks become sort of the priority, and getting through the day and covering a 12-hour shift, and all of those things are very important, absolutely. And I think what sometimes gets by the wayside is we think that by connecting or having to sort of spend time with a patient or family, it takes up too much time, when really it's not about time. It is really about just being present and being there, and making their day in some way, shape, or form. And it doesn't take time. It just takes a different focus and a different intention. And I think that's what people are wanting to be able to do, is how do I shift? How do I switch in the midst of my busy, crazy day? How do I in the moment be there for somebody, and to be able to continue on with all the things I have to get done in the day? So I think there's an and in there. It's not an either or. And I think up to this point, we've been thinking it's an either or. Either I get stuff done and I have to get through my day. And if I even, sit on the bed or spend any time connecting, that's going to suck my day. It's going to suck the time out of my day. And I don't mean that disrespectfully. It just is, there's so many things that pile on. And so how do we make it an and, that yes, I can still get all the things I need to get done, and how do I be present and focused when I need to be, and how do I make that switch in the moment?
Okay. And so from your experience, you found, if I'm hearing you right, that using coaching skills, a coach approach was actually supporting that.
Mm-hmm. Especially the listening,
Okay.
really attentively listening, and asking people better questions about who they are, not just about what they need or what's the surfacey type of stuff that we do every day. It just allows us to get a little bit beneath the surface and connect with people.
Right. Okay, great. And we might come back to that a bit more as the webinar unfolds. And Artie, I realize that I always get a little nervous when I start delivering these webinars, and I kind of miss things sometimes. And I know that you were going to speak a bit more to and I'm going to just move back to it a little bit about those pains that and the challenges that are going on in healthcare.
Yeah, thank you very much. And it's a pleasure to be on the call today, Allison.
Yes.
And everybody else who's on there.
Yeah.
From my warm and sunny Nevada.
Ah.
So yeah, the challenges in healthcare. As an executive coach, I work exclusively in healthcare, both on the practicing side as well as in the academic side, deans and assistant deans. And it's, it's interesting that 100% of those on the poll actually see these as key challenges. And Dory, I think you very eloquently delved a little deeper in some of the issues around it. Some of the things that have been coming up in my coaching and with the clients in healthcare that I work with is that sort of depending a little on the generation you're in, a lot of the now leaders in healthcare may not have been exposed to a lot of formal training around leadership. Certainly, there are a multitude of courses now to take, and people do take courses, and there is a need and an interest in further developing leadership skills. Maybe not as much in the one-on-one that we have in coaching as, more group setting. We also have children who've just graduated off of med school, and I have to say that I think that's somewhat changing, that working in teams and understanding that there are other skills that they kind of need to be trained on from the very beginning.
So that's very interesting that you say that. You're noticing that it's beginning with the people that are coming into the field more so. And can you give an example of what you've noticed?
Well, I think the obvious one is that, you can actually now do combined programs, MD and MBA. And even in the MD, training, there is more exposure to leadership skills, the understanding of leadership skills, and even in some residency programs, I think Johns Hopkins is what one of our sons said, they actually offer coaching to the residents to support them going through the residency. So I think that's a really interesting development. Linked with that somewhat, what I've observed is that, again, when we're looking at the leadership generation, 50, 60, and 40, often the promotions to leadership positions are done from a skills perspective. Could be linked to publications or other skills. And, the leadership, the way you show up as a leader is really not supported as much, maybe as even valued in the promotions. The Peter principle, right? The promotional skill. I think the other point I would like to make here is that there is a deeper understanding, and I think, Dory, you certainly addressed that too, around the culture and the culture that leaders are able to influence and the values that they can promote, role model, demonstrate when working with teams. The importance of that, again, often over technical skills and all the administrative duties, which is a whole other challenge.
Right. Okay, well, thank you so much, Artie. And, as we unfold, I welcome your interaction and Dory's and Ace's. And Ace is going to say something in a little bit. Stay tuned about that. So, okay, so then I'll just move a little bit further ahead. this is an area, and last year, when we presented it to Harvard, we were at Harvard Medical School last year. Well, all of us actually, because I met Ace there. But we came up with some findings based on a very large healthcare organization, and we'll share those in a moment. But one of the things that came up that was so interesting when we were there was that there were people there who did what we called coaching for people to become well. In other words, it was really focused on people who were trying to lose weight, or they had various issues, and that is very, very valuable. But there was this impression that was given that anybody who was going to do some coaching was going to be required to get some certificates. In other words, become a certified coach and become extensively experienced in coaching. And that, by the way, that is fabulous. And we want people to do that, absolutely. But what we noticed was that was quite a strong impression. And what we're talking about, what we're saying is that everyone in healthcare needs to learn these skills as part of the work they do. I mean, Dory's addressed it, Artie's spoken to it as well, and that it can be an approach to conversations, as Dory was kind of briefly mentioning. So for example, and I'm just thinking, for example, focusing on an approach to conversations where you're focusing on that other person and you're being curious, I'm wondering, what are you finding as your biggest challenge today? Or maybe you're running into them in the hallway as you're talking. That's another myth that came up, is that it had to be an hour-long conversation by appointment only. And what we're speaking about is being coach-like and using those skills and the things that you learn as part of what is required when you adopt a coach approach in multiple conversations. And as I said, when you're wandering down the hallway for a few minutes here and there. And I'm just wondering, I'm just thinking, I've covered, it can be 5 minutes, and I'm curious, I'm just wondering, Dory or Artie or even Ace, if you've seen, if you can give an example of where you've seen something happen in that short space of time.
Well, I see it all the time, and I've seen it all the time. So what happens is it becomes the way of being for them, and it's who they are as they approach conversations. And so even just the other day, someone mentioned to me about a couple of my colleagues who they were impressed by how they, every day, every minute of the day, the way that they show up is different than a lot of people. They show up to each conversation in the hallway, and it doesn't matter where, just present and focused on that person for the 2 minutes that they're in that conversation. Even just asking one or two powerful questions, beyond the "how are you, I'm fine" conversation, and being able to connect with people in a short amount of time is what I would say. It's a way of being, or approach to how you're showing up, versus it just being a skill or a thing that you do. People say, I did it. I tried it on somebody, versus actually it's how I actually approach the conversation. It's actually how I'm present with people. So I mean, I could give you a gazillion specific examples, but that to me is more about what we're seeing, is that people start shifting the way that they actually approach their day-to-day way of being.
Okay, thank you very much. And that's well said. I'm going to move to something else, because here's what happens. Here's what has happened when this occurs. In other words, when people are taught some coaching skills, an approach, a simple model that they can use, here are some results, some very important results. I mean, what if, and you're all reading this, you can all see the slide, but what if in your organization there was improved listening? What if there was improved communication, ability to give feedback? I mean, positively impacted relationships. These were the results. These were the results that were achieved. Ability to engage staff in conversations that are solutions focused and promote accountability, for example. These were real results that were achieved, and I've mentioned below how they were, how it was assessed, how they came up with this. This wasn't my results. This was externally determined results, and that's why. And when we presented them to Harvard last year in the fall, we found that we could not find anybody who was doing it on this wide a scale. I mean, this was very, very significant. And here's another one that I'll share. And this was with another healthcare organization as well, because like I said, we've done it with a few. And they came up with these metrics based on what they determined they wanted to see had happened. And again, these are quite significant results. And this was, as you can see in my notes below, this was post, 6 months post, which really shows that it had some sticking power. It maintained it. And I'm kind of curious, you know, what organization wouldn't want to have these kinds of results amongst a large number of their healthcare workers? So I think that's really important. And I also wanted to bring up a slide that what also occurred when it was adopted, when it was presented, when it was delivered in an organization. It started with, and actually Dory, you can speak to that because you started with a small, a small group, and then could you share just a little bit about what you saw happen as a result?
Yeah, so we started with just really our intention when we started with coaching was really to embed it into a leadership program focused on frontline nurse leaders. So these are the nurses who are in the, it's kind of once you can get tagged, you're the leader now in the unit. So that was our initial intention. And as we started to do that, more and more people said, can we join in? Can we join in? So it spread from being nursing leaders to an interprofessional group. And then we also did it with teams that really wanted to sort of do it in terms of with their team dynamics. And then it started spreading to more being clinically focused on patients and families. So it just kept, every time we sort of were thinking that we were, settling into a good sort of model, more people wanted to sort of add it to their repertoire of skills. And so it really went from just being about frontline nursing leaders to all levels of leaders, and then to frontline clinicians, and then with dealing with patients and families.
Great, thank you. And then Ais, I'm wondering if you could share a couple of things about the work that you did, because it fits so beautifully in with this particular slide, because it's the workers in healthcare, it's the patients, it's so wide-reaching. And so, Ais, could you say a little bit about what you discovered when you were coaching, you were using coaching with diabetes type 2 patients? And you just need to take your mic, undo your mute. Great. Hi, Ais.
Hi again, and thank you for the opportunity. Yeah, when I was coaching my patients actually in Denmark and Turkey, what I discovered was actually, I don't know if Dory and Artie will agree, but most of the patients actually know what to do or not to do in terms of being healthy, like eating healthy or being physically active or anything else. They have the knowledge, but they don't have motivation and support. And in addition to that, there is a big challenge. They cannot actually connect this kind of one particular health behavior to their life vision or to a big picture in their life. So they need to get aware of their personal resources and how they can use it. And this requires the support and motivation and lead of the coach and coaching skills. So.
Okay, and so I know that, all right, is there anything else you want to say about what you discovered? Anything else as a result of using coaching skills with these people?
Yeah, when there is first, it's very interesting. When you coach them, they start to coach themselves and they learn very quickly and they start to coach themselves and they become suddenly very eager to coach their family members, daughters, husbands, or social surroundings. Like in this PowerPoint slide, it's like it's spreading. Even though you are doing one-to-one coaching, it's amazing and it's spreading, and they are very eager to learn, even though they are patients, they are not professionals. So, and what interesting was I worked with people from very low socioeconomic status, mostly from secondary school education. So it was very interesting to see how coaching had impact on them regardless of education level.
Ah, right. Okay. Well, thank you. Thank you. So, I mean, you can see the impact and how it can spread. So now, what were the elements? What were the key elements that contributed to this success in these healthcare organizations? And as you can see on the screen, and in a second, I'm going to ask Artie to speak to some of this as well. But as you can tell, you can see on the screen what were the key elements. And I think what was significant is that it was an easily adopted program. But there was also, so that was very important and something that everybody could adapt, and that's what this is proven out to be, because it's moved right from, right through multiple stakeholders, multiple areas. But I'm wondering, Artie, if you could speak a little bit to the whole business of internal champions and how the importance of that, what you have seen.
Yeah, so the people that I connect with on this program, I think, are very excited about the fact that it is very easily adoptable. It's easy to get. It can be rolled out to larger groups at all levels. It is also clear, and I think, again, that ties in with that setting the culture and supporting it from sort of the leader's perspective. When you notice that leaders are supportive of coach-like behavior, are modeling it themselves, and are then promoting it into the larger group, it can be very powerful. At the School of Nursing that I'm working with in Sacramento, we started out with the leadership, and then really they were so excited about the possibility of adding these almost life skills, really, to their repertoire of how to listen, how to not be judgmental in a conversation, how to stay curious, and how to ask powerful questions. I think those are really key elements. And so with the support of the leadership, it just makes a lot of sense to then roll it out.
Okay. And the other thing is this whole business of the ability to develop internal capacity. So, for example, it's not long-term for most healthcare organizations. They have budgetary issues, and if they can be developed internally to deliver this and to expand it in a very cost-effective way, that is also extremely significant. The ability to develop that internal capacity is profoundly important to spread it throughout the organization. So how do you roll this out? What have we seen happen? And so here we're talking about organization A, we'll call it. And what they did is that, as you could see, they had to make sure there was stakeholders within the organization who bought in. In other words, there had to be some champions. And they also determined what was it that they were going to measure. In other words, how are they going to know? What was going to tell them that this was going to be successful? As well, they linked it to a larger leadership development program. And in this particular case, they brought a number of leaders that were selected from a large geographic area, and they brought them into one location for 5 days. And for the first 3 days, they were delivering them other leadership development programs, 360 assessment training, learning a lean methodology in this organization's particular case. And then what happened was we had them for the last 2 days. And what happened was we delivered our coaching skills program over this 2-day period, and it included, in that 2-day period, it included practice. But that was not enough. In other words, we knew that there needed to be, okay, what is going to support the embedding of the learning? This is very, very critical. And that's where we did an additional 6 weeks of what we called virtual practicums, and where the leaders and the managers and the directors, etc., in this particular organization's case, came together via our virtual classrooms. And they got feedback. They had to coach, they were coached, and they got to observe coaching, and they heard multiple different types of coaching. I mean, people coaching, different types of people coaching, and getting feedback from experts, in other words, expert coaches who were there. But also they got to observe other people coaching and getting feedback on their coaching over this 6-week period in 90-minute increments, so that it could also be very developmental. In other words, they could take away what they learned there and then incorporate it in the following week or two between their practicums. And then step 3 was that they knew that they could develop internal capacity. So there was key people chosen who were internally developed. And in this particular organization's case, some of them were, in some cases, they were credential coaches, so they just needed to do one program, and others needed more extensive training, which they did with us, and we supported their depth, deepening their depth in coaching, so that when they were delivering it to various leaders and managers, etc., that they had the ability to do that successfully in that organization. So that was one example in what we're talking about is Organization A. And we were all, well, a number of us were there, and they, like I said, they brought a large number of people together, and this was over the course of about 4 years. And then Organization B was a little bit different. This was where they've developed about approximately 4,500 people in learning these coaching skills. Again, they had internal champions, but they were not necessarily at the complete senior level. And have I got that right, Dory? Yeah. But there were internal advocates, and a few of those internal advocates assessed the program that we have, looked at it, and then decided to become licensed to deliver it. And that's how it started, is they started to do that, and then it just grew from there. In other words, it expanded, and so what they realized is this was working, this was of value, and so they decided to invest in expanding internal capacity, and now there's approximately 100 people within this large healthcare system who have been licensed to deliver it and are expanding it internally. They did not bring a team of external people to the organization. They developed it completely internally. So that's just an example of how that happened. And there were some learnings, and there was some learnings in both cases that happened. And I know that there was a critical was the practice opportunities, the practicums, and in Dory's case, you divided up people into triads so that they could practice their coaching separately, and they scheduled times to do that, and then they got feedback on their coaching that way. That there was a real emphasis in any of this that it was all done it was real. There was not a bunch of role playing and kind of pretend examples, etc. It was all done using real, it was insisting that people talked about the actual real challenges that were going on currently. There also was opportunity for refreshers. In other words, I remember attending one where it was called a coaching cafe, and they brought a number of people together and they demoed it again, and they got everybody practicing their coaching skills again, so that it really supported the embedding of the learning. The other thing that made the other learning was to link it to other programs or existing training that was offered, and so that it supported the other leadership initiatives. Okay, so those were some big learnings, and I'm gonna stop right now for a second, and I'm just going to invite people. If they have any questions, I just want to see what is coming up for you as a result of what we're sharing. Anybody? And I'm going to look to see if people, I'm just going to look down, and you can actually raise your hand. I think it's fairly obvious, but I'm gonna just let Sandra. What is the easiest way if somebody wanted to ask a question, aside from entering it in the chat area, but also if they wanted to raise their hand? Is there any way that they can do that?
Hi, Allison. Yes, they can. On their screen, you can actually have the option on the top left-hand corner of your screen to raise your hand. And if you do that, I can see if they've raised their hand, and I can promote them to a panel.
Oh, perfect. Perfect. Okay. Well, we'll watch. Okay, so Sandra, I'll let you watch. You'll watch that, but I'm also going to invite Artie and Dory to talk a bit more about this as well, because I just suddenly think Dory has disappeared. I can't see Dory. Oh dear, she's gone. Oh well. Hopefully she'll come back. But I'm just wondering, what else did we see that really made a difference? Oh, okay. Check the Q&A section. Okay, I'm just looking for the question. I can't see. Oh, hang on. Adopting a coach-like approach to communication can have far-reaching impact in any industry, not just healthcare. It would be good to broaden the audience, since many more workers could benefit from coach-like communication. Absolutely. That's right. Does Coaching Out of the Box have presence in Africa? We are tuned in from, okay. Great question. Actually, we have had some presence in Africa, in Kenya, of all places, in Nairobi, actually. And that was through an organization that we delivered an intro to coaching with, called Lingos, that works with a number of NGOs. But on the ground, no, we don't have a presence in Africa.
And I think actually the first point, if I just may build on
yes.
that, a lot of this research and data that you have came out of that large healthcare initiative. And as you said in the very beginning, this can be rolled out in any organization, because it is really about an approach. It's about skills that apply to all of us in any organization. And even though at this point the data is related to the healthcare initiative, it's clearly applicable to any organization.
Ah, great. Okay. Yes, and I'm also seeing another question, and it's how much, if any, did you need to make any changes to the program? And I know that Dory is actually still here, and for some reason, okay, maybe that's what happened. There you are. Sorry about that. You just sort of disappeared there for a moment. Anything, I'm curious from your perspective, Dory, and thanks already for that answer. Did you have to make any changes? Carolyn's asking if any changes had to be made.
What we did is we would sort of shift some of the, so during the workshops and sort of during the examples, we would tailor them to the group that we are working with. So if I was working with a group from, the pelvic pain clinic, for example, at BC Women, or at the Women's Hospital, I would, the examples I would use might be different than, say, a group that was maybe generic, or if we're working with physicians, it might be different. So we just changed some of the examples, or the time frame, depending on what it is that we were trying to focus on. And so it was the nice thing about the program is it has a lot of flexibility built into it, where you can massage it the way that you want it, and really tailor it to the group that you're working with, but while still maintaining the integrity of the framework. So the framework transcends all disciplines, all industries, all all ages really, and all levels of leadership. It's sort of how you massage it into the examples that makes it more relevant.
Okay. Yes. And there was something that you made me want to say. You see, the whole program is delivered using a coach approach in the actual delivery of it. When we deliver it, when any licensed trainer, anyone delivers it, they're taught to tap into what are the current challenges that are going on for the people that are in attendance, whether it's they're attending virtual classes or they're attending live, so that it speaks directly and so that they can use those direct issues and challenges that they're experiencing. Just like Dory was saying, she modified it or adjusted depending on the group, because that's what makes it so powerful, is that it's very much focused on their real life situations and challenges at hand, and that they're using those as they move through it, so that by the time they're done, they not only have learned coaching skills, but they've also solved some issues and challenges that they're having, and they're walking away with some key action steps that they're going to take, or something that they're going to do about a particular situation that they are dealing with. And I noticed that, Ace, I apologize, it looks like you wanted to say something and I missed that. So was there something that you wanted to say about this as well?
Yeah, it's part of it, and it was related to the first question. Actually, what we have learned from health coaching can be adapted to other organizations. For example, now I'm working to train prisoners as health coaches. So we are adapting health coaching experience and what we know and our skills to the training in prison. So there is no space boundary. So that was the answer for another answer for the question one. So that's
great. Okay. And another thing that I'm thinking about here is that when we've seen it delivered, they've really set the stage for success. In other words, remember we talked about some internal champions. I'm wondering if we can say a little bit more about how they did that. In other words, how was that, how did the organizations ensure success? So I'm going to give one example, and I think, Dory, you might be able to speak to this as well, is that this one large organization where we went and we delivered it to a large group all at once. Well, they were divided up into several different rooms, and we had a team of about 10 trainers there. But there was a point in the first day where they attended a lunch, and it was a lunch that was launching this. And what they did there is they had their senior leader. Well, actually, excuse me, it was a government organization, and the Minister of Health actually came on a large video, Skype type video, and spoke to how important this program was, and expressed their advocacy for it, and you know, how important it was. And this came right from the very, very top in this organization's particular case. So that was a wonderful demonstration of how important they felt it was, and how important the initiative was, that the Minister of Health in this particular case spoke to the group of people. So that was one example. But I'm wondering, Dory, if you could speak to what other what was it that was done for you to ensure that it was going to be a success?
Definitely for us, we knew that we had to develop internal capacity. It was just too expensive to have external coaches and consultants to do it, but not just the expense, but also the relationships and the connections that people internally had with people in the organization, especially the more local that we could get it. So the more people we could train that were embedded in the organization, the easier it was to spread, because the reality is when we did it, we had the triads, and a facilitator would be present for that triad to make sure that sort of things went as smoothly and on feedback. Often, you know, people say, I can't make it, unit's crazy busy, can't happen, it's not going to happen today, can we reschedule? And yes, we can, because we have the ability to do that. With an external coach or someone that you're paying, it just can't happen that way, and it just got too hard to do that. And so the flexibility that you have when you develop internal capacity, using people that are clinicians, a lot of our educators and people who sort of were in education type roles were the primary facilitators in the organization. So it made it so that they had not only I won't say the time, but they had the ability to flex their time more readily, and be there when they needed to be there. So it makes it easier to spread when you have people that are basically in all areas and approachable that way.
Right. You know, the other, thank you. Very important. And we're just seeing, we got an excellent comment, of course, in the chat area, and it's from someone who is from an organization who's done this, another organization, and I can just see I've got another message here. Yes, okay. So, Melissa, would you be willing to share a little bit? Thank you for being willing to become a panelist, because Melissa made a comment in the chat area. Melissa, can we hear you? You've got to unmute yourself. Good, great. Hi, Melissa. There you are. Don't know if we can't hear you. I wonder if your mic is turned up. It looks like you're in a car. All right. It's amazing technology. Yes, oh, that's too bad. It's something's missing there. I guess anyway, thank you, Melissa. We probably should have tested that out. I just did that off the cuff. But anyway, it's I think I'm hoping everybody can see the chat. Yes, it was to everyone. Is that yes, the internal champions, and yes, okay, great. Well, thank you. Sorry we can't hear you. Would have appreciated that, but that's the challenge of technology. So, you know, another thing that I'm wondering about as we speak, and we've only got a few minutes left, and so there was just, I'm wondering what if anything else has really ensured that this was successful. What was another key piece that we may not have touched on yet that has supported it being successful? And I'm curious if Artie or Dory or Ace has any additional comments about that. Dory, go ahead.
One of the things that I think is paramount is practicing and ensuring that people have the ability to practice and be safe to practice and be challenged to take it to the next level and be challenged to stretch in a quote safe environment, learning environment. That to me is key. I think that a one-day sort of workshop or a one-day delivery, or however people sort of do these communication workshops in a day and say we're good to go, it doesn't work. And so I think the importance is to have practice over time and build on the skills and focus on one or two things, and then build on it and build on and build on it, and then have the ability to then come back in a 6 month or a year's time to then continue to sort of grow the culture of coaching. And that's what I was talking about with the coaching summits and the coaching cafes. And we had coaching, we had a coaching journal club, we called it Coaching Connections. So you have to also provide a lot of opportunities for people to continue to practice, to continue to sort of do it, because it does get veered off from the day to day if it hasn't yet become you. So once it becomes who you are and it's your way of being, then you're good to go. But it takes a while for that way of being to emerge. That's what I would say.
Okay, great. Anybody else? Here's somebody asking, although it may seem minor, I've kept the tent. Oh, that outlines the who, what, how, and my vision since participating in the program. Oh, I know what you're talking about. Yes, actually, it's an awesome visual reminder. It constantly reminds me to be curious. Well, thank you very much for saying that. Here, that actually speaks to, there's some, in the materials that everybody gets when they take the program, there's a number of items that support the embedding of the learning as well. So there's a pyramid that has the models on it, already showed it. There's a 365 coaching questions booklet. There's a video, a DVD with the modules in it. There's a bookmark. There's the learner's guide. There's the pen, the trusty pen, but the whole purpose was to make it easy. And it was like a kit, as I remember Dory saying that. So that also, I never heard it called a tent. Yeah, I never had either, but that's a great name too. Anyway, so you want to equip whoever you're delivering this to with some tools, some easy ways that they can walk away. What I know for myself, what I have experienced is sometimes these things can be so esoteric and so involved and so difficult that people just don't know what they're doing. And so we wanted to make it easy. And I see someone else is making a comment. Yeah, the ongoing training and the networking. Right, exactly. So lots of great comments and questions. I really appreciate that. And so I just want to mention about What's Next. We're here to support you. We're here to talk to you. If you're interested in hearing more or learning more about doing something like this within your organization, be it healthcare or otherwise, please contact us. We'd be happy to chat with you in more depth about that. We also have a readiness assessment for organizations on our website, and we have some public programs as well. And we also just started a LinkedIn group called Coaching in Healthcare. Check it out, because we're wanting to support, again, more dialogue about this, sharing best practices, sharing what we've learned, hearing about some of the challenges, hearing how it's being used, et cetera, and what is literally going on in bringing coaching skills to people that are in healthcare. What I also want you to know is that there will be a follow-up email that will be sent out to all of you after this webinar completes, and the resources will be there as well, because we realize when you're looking at a slide you can't necessarily click on that link and go immediately to it. So I'm just wondering, I also just wanted to say I really wanted to thank our panelists for contributing today to this webinar, and I thank you so much, Artie, Dory, and Ace. These are passionate people in healthcare who really have been making a difference. So I'm so honored that you would come and support this webinar today. And and you could also contact me as well, and that will be in the follow-up info also. But I have to leave the webinar with just putting this up, because what if everyone in healthcare got these skills? That's what our vision is, and I hope that today's webinar has been helpful to you with the work that you're doing, and thank you everybody for attending. Okay, right on the dot, we're ending. Bye.